that the plan on this side is the practical plan that will work. The plan on the other side, if they have a plan, is something that is completely impractical, has no chance of working, and that's why the New Zealand public support this government and this very good budget. Thank you.
I call the Honourable Mary Ann Street.
Thank you very much, Mr Speaker. I rise to speak in this appropriations debate on that part of the budget that takes some 19% of government expenditure, and that is health. Mr Speaker, the total health budget is something in the order of $14.1 billion, so nearly 20%, 19% of the total government appropriation. And if one were to believe Tony Ryle, one would think that all health services are performing better than ever before. There are no difficulties here. Move right along, there's nothing to see, except those occasional statistics that the Minister wishes to shine a very fine spotlight upon. And those are the things where targets have been met because of the blood, sweat and tears of our professional health staff working in district health boards who have, because they have been funded to do so, but sometimes not, have worked extremely hard to meet the targets, the short-term measurable targets that the Minister has set them. The truth, however, of the health landscape out there, Mr Speaker, is one of cost cuts, of chaos and of impending chaos. The expression death by 1,000 cuts takes on a new meaning under this Minister of Health. There is a whole new meaning to that expression when we realise that the funding in the health sector is $230 million down on what is needed simply to keep up with cost pressure. Never mind catering for a larger ageing population or an impending diabetes epidemic. Never mind those things. Simply looking at cost increases, Mr Speaker, the government is $230 million down on what is necessary in that area. So the district health boards are not even being funded to break even. They cannot cover their costs. They cannot meet the increasing demand of an increased population and an ageing population, Mr Speaker. In the budget, only $358 million was new money. The district health boards in particular are being asked to do more with less. They are being asked, for example, to absorb all of the KiwiSaver liability that they have not been previously asked to cover. There was no additional appropriation for the covering of the KiwiSaver liability. That used to be taken care of centrally by government and is no longer to be the case. So what we have now is some of our district health boards spending huge proportions of their new funding in covering new liabilities, not funding that was given to them or tagged for that purpose, but funding that they have to give out because the government has withdrawn from liabilities it covered previously. Let's take, for example, Canterbury, our most smitten of district health boards, our most desperate district health board trying to recover from its devastating earthquakes and at the same time meet the Minister's short-term measurable targets. The Canterbury District Health Board has a projected liability for KiwiSaver of $8.6 million. Mr Speaker, that's about 42% of the new funding it's been given. So nearly half of its new funding, which is meant to be delivering all these things the Minister requires, is having to be spent on KiwiSaver contributions. There is no recognition of that. The KiwiSaver contributions are critically important to the economic welfare and future of this country. If we are ever going to deepen our domestic capital markets, KiwiSaver and New Zealand Super are the mechanisms to do it for us. However, the government is not taking any responsibility for that, and so Canterbury District Health Board is having to take up 42% of its new funding to cover that liability. Even little wee district health boards like West Coast are having to spend 34%, one-third of their new funding on their KiwiSaver liability. Mr. Speaker, listening to the Minister of Health, as I say, one would think that all was well in the health garden. Well, it is not, Rosie, in that health garden. I'd just like to stress for a moment a number of the things that have been cut by this government. Let's just take a few down-to-earth practical examples. Dannevirke Outpatients Clinic cut. Counties Manukau has had to cut funding which included 2 Māori health programs and Auckland University's evaluations of the board's 5-year $10 million scheme to reduce the incidence of type 2 diabetes. Mr. Speaker, these efforts are being cut out in the community because the Minister is requiring DHBs to turn on more elective surgical procedures so he can go and award certificates to those poor DHBs who have tried desperately hard without the funding to do what the Minister requires. Mr. Speaker, just as an example of this, I'd like to quote from the Nelson Mail, because just recently the Nelson Marlborough District Health Board showed that it performed 6,209 operations, 150 more than during the last financial year, and yet the District Health Board Surgical Services Manager, Dorothy McEwen, said that its elective teams had done a terrific job to surpass the elective target, which they have, and I take my hat off to them, while at the same time ensuring that no one was waiting longer than 6 months. But she said, and I quote, "We were required to support this with extra resources that were not budgeted for," unquote. So what gets cut? What gets cut? Well, Mr. Speaker, the government has cut numbers of things. It doesn't matter whether we look back a couple of years or we concentrate on today. The abandoned school food guidelines, for example, when this government came in, an absolutely no-cost item that the government chose to cut because it was something the Labor government had in place. Food nutrition guidelines to secondary schools, to school tuck shops, encouraging them to sell only healthy food. And so what has that done? Well, quite frankly, Mr. Speaker, it has done nothing to improve our obesity problem and the tendency towards type 2 diabetes that problem will produce over time. So the government has cut frontline public health programs, some $12 million from tobacco control, $8 million of sexual health promotion and prevention programs, $1 million from public health, alcohol and drug services, $4 million from mental health, workforce development, and on it goes, Mr. Speaker. This government is cutting health at every turn and in fact replacing what should be long-term health goals with short-term measurable outputs that the Minister can then trumpet, because those are the things that he is funding, and he is not acknowledging what the experts are saying, which is that in order to reduce our health liabilities and the cost of health in the future, we need to be putting more into prevention. Mr. Speaker, there is a report that has gone to the Ministry of Health because they wanted to find out how to deal with diabetes care and management, given that they have cut the Diabetes Get Checked program. When we had this epidemic coming down the tracks at us, why would a government stop the Diabetes Get Checked program. And the report says that there was a recurring theme amongst those who were consulted that prevention and early intervention were not being funded as a priority by this government or even included as a specific target. Mr Speaker, for all that the Minister trumpets successes in the health portfolio, he is really jeopardising the future health of New Zealanders.
I call Katrina Shanks.
Thank you, Mr Speaker. It's my pleasure to take a call on the Appropriations 2012-13 Estimates Bill.